we're back on the lab side of the Atlanta Fibroid Center, and down at the end of the hall you can see the doorway where patients will enter. Wanted to take you through kind of a typical patient experience. We're in the lab side of the Atlanta Fibroid Center, back where the patients' rooms are. Every patient at the Atlanta Fibroid Center has their own private room, and that's really important. A typical room is right in front of us, and you can see there's this patient stretcher and a chair for patients' family members and a flat screen TV, as well as the typical monitoring equipment that's necessary for patients during their stay here. After they arrive and they are get into a gown, an IV is placed, and then the patients will be escorted over to the angio suite where the procedure is performed. So we'll walk this way over to the angio suite. So this is the angio suite with state-of-the-art angio equipment. It's a dedicated angio room with GE and Nova equipment. State-of-the-art flat screen technology. As the patient is brought into the room, the patient's head is at this end, and there's our fluoroscopic equipment where we'll be looking at the patient during the procedure under X-ray, and the images will appear in live real time on these screens. I've placed a MRI of a typical patient. This is an MRI that we will reference as we do the procedure. This particular image is taken in the coronal plane, which means we're looking straight at this person. So the patient's right is over here, the patient's left is over here, and what you see in the middle of the screen is a very large uterus, and within the uterus it's enlarged largely from this big right-sided fibroid right here. In white is the edge of the uterine cavity, and so this fibroid is about the size of a grapefruit to large orange, and it's indenting the right side of the uterine cavity. It's pushing things leftward. It's also on top of her bladder. You can see her bladder here in white, and so she's having very heavy periods from the displacement of the lining, also getting urinary frequency and waking up at night, and the sheer size of this big fibroid is pressing on the pelvic nerves which run along the side wall of the pelvis. And she has all of the classic symptoms. One additional finding here is from the enlarged uterus, which is the size of a 4-month pregnancy. You can see the black line here. This is the muscle that everyone does crunches and sit-ups for. It's called the rectus abdominis muscle. And normally the rectus abdominis muscle, even if you don't work out, is straight as an arrow, and it attaches on the pubic bone, and it's a straight line shot. But you can see in hers bows out significantly, and as the uterus enlarges in women with fibroids, it makes them look pregnant. And this woman has a uterine size of a 4-month pregnancy. I'm sure people are asking her when the baby is due, and it's very embarrassing for women suffering with fibroids to look pregnant and have them be asked about the baby that they don't have.